All right, so I'll go ahead. Let me go ahead and do a quick introduction
Sure.
to everybody. Well, thank you everybody for joining us today, and welcome to our very first webinar at Pegasus Medical. My name is Munir Kui. I'm the president of Pegasus Medical USA, and today we're thrilled to have Yaron Shavit with us. Yaron is the CEO of IntraPosition, and he will be sharing with us our recently deployed platform that helps with alleviating stress for the emergency departments. As we all know, the increasing strain on emergency departments in the US and generally around the world in regards to overcrowding, prolonged wait times, and bed shortages, our clinicians are facing immense challenges that impact patient care and, of course, their own well being. So Yaron will delve into these urgent issues and explore how IntraPosition's emergency department command center can help optimize resource allocation and improve care coordination. The added, just a couple of things. So if you have any questions, feel free to share it in the chat. I'm happy to address that with Yaron as we go along. Or you could wait at the end of the presentation and we could address those questions as well. This meeting will be recorded. I hope you don't mind, and it'll be shared internally. We could share it with you guys, of course, after this is all over. Thank you. Thank you, Yaron. It's all yours.
Thank you, Munir. So hello, everyone. As well introduced, I'm Yaron Shavit. I'm the founder and CEO of IntraPosition. We've got Mayan Darky here with us today, our Chief Business Development Officer in the shotgun seat, so beware. Our mission at IntraPosition is simple. We transform healthcare operations through cutting-edge technology. As a proud Pegasus Medical subsidiary with clients spanning 3 continents, we're not just delivering solutions, we are setting new standards. Today, we are unveiling a game changer, the IntraPosition Emergency Department Command Center. This isn't just another product. It's a revolution in how emergency departments operate. I'll also give you a glimpse into our real-time location system, or RTLS in short, which is closely integrated into the command center. The RTLS is a powerhouse for asset tracking, patient tracking, staff safety, and actually any location-based application in the ED specifically, and more generally in the hospital. Together, these services create a seamless integrated ecosystem that supercharges efficiency across the board. As Munir mentioned throughout the webinar, I encourage you to ask questions, just type them in, and I'll do my best to address them as we go along. Let's make this session as interactive and valuable as possible. And I'll let you guys and myself focus in the presentation. So if you don't mind, I'm going to turn off the camera and move on. All right, you should be able to see the presentation, right? Slide 1. All right, so I would like you guys to think of IntraPosition as the nervous system of your medical center. As a nervous system, an intelligent network of sensors and a brain that keep everything running smoothly, efficiently, and safely in the hospital. Our suite of digital services includes Emergency Department Command Center, RTLS, crash cart management, audit management, wayfinding, and more. It is designed to optimize every facet of your operation. Today, of course, we'll focus on the emergency department. Now, while clinicians, doctors, and nurses focus on patient well-being, we are dedicated to the health of the medical center itself. With countless moving parts in this complex machine we call a hospital, we ensure that caregivers have exactly what they need and exactly when they need it. Our technology doesn't just support, it empowers them. By automating routine tasks, we lift the burden of caregivers' shoulders, allowing them to focus on what truly matters, And that's, of course, delivering exceptional patient care. Emergency departments are the most challenging environments in any hospital. Everyone agrees. They are fast-paced, high-stress, and incredibly demanding. But with great challenge comes great opportunity. And the opportunity is to excel. One that we are here to help you seize. In the relentless environment of an ED, staff must manage constant influx of patients, each with unique conditions and varying levels of urgency. Every second counts and every decision may be critical. Modern medicine demands precision and collaboration from a diverse team. Nurses, doctors, blood drawing team, ECG technicians, imaging technicians, and more. Even the environmental services staff play a crucial role in reducing patient turnaround times. But orchestrating this complex operation is not easy. And when ED operations falter, patient satisfaction plummets, wait times increase, and staff burnout rises. These aren't just statistics. They are real impacts on healthcare quality, costs, and most importantly, patient outcomes. And that's why we're here today. We are here to show you how IntraPosition Emergency Department Command Center can transform these challenges into triumphs. By the end of this webinar, you'll understand why this product is not just innovative, but it's actually essential. So, with no further ado, let's dive in. Now, when our product development team worked closely with our design partners working on this innovative product, a few requests came up again and again. They said, we need a centralized system. It's a single place where clinicians can get a clear view of the ED. Another request was to get rid or at least reduce the overutilization of the PA. The public announcement system, sometimes visiting a busy emergency department feels like visiting a busy airport, only you don't get to walk through duty free. So this one also was addressed developing this product. Another request was, we need to offload as many routine and operational tasks from the shoulders of the clinicians. And lastly, clinicians' time, and specifically doctors in this case, is precious. We need to make sure we use it as efficiently as possible. We took all these inputs and many more, and we kept them in mind when went through development of the command center. Well, this is what we came up with. A centralized system, AI-powered, that receives inputs from multiple sources and supports a large team of caregivers and clinicians. The system processes big data in real time, creating a clear, unified, and integrated bird's eye view of the ED. It connects all team members digitally and efficiently to orchestrate ED operations. So in one side, we have multiple input providers. Of course, the staff members, either through their mobile devices or using designated tablets installed in every treatment bay or every room in the ED. We've got the RTLS, which provides valuable real-time location data and the whereabouts of every asset and staff member and patient within the ED. And we've got the hospital information systems, the ADT, the EHR, that provide inputs as well. The command center compiles all the information in real time to create a clear view of the ED and allocates tasks to the relevant team members. This picture that you see here on the right-hand side of the slide was taken in a handoff meeting just a couple of weeks after the system went live in this emergency department. And this is how it's done today. I mean, every handoff meeting takes place in front of the big screen at the center of the relevant section, and discussing and handing off one patient at a time is done right in front the command center map view. Very convenient. Now, to convey you the importance and the value of the system, we selected a few real-world cases, examples that can be found in any emergency department. Let's take case number 1, for example. A patient arrives at the ED. After a quick exam and the triage, the clinician sends the patient to bay 25, as recommended by the command center load balancer model. She doesn't need to walk the floor. She doesn't need to peek into bays. She doesn't need to call anyone. She gets a clear indication in the command center. Case number 2. The ED is packed as usual, and there's a peak in demand for blood tests. The phlebotomists, the blood drawing team, are doing the best, but still wait time for blood drawing is peaking. The command center AI engine detects the unusual rise in wait time and notifies the floor manager, which allocates resources to support the blood drawing team. Moments later, blood drawing wait times are back to normal. Case number 3. A patient is discharged from bay 17. The command center initiates cleaning request to the environmental services team. Only the relevant team members get notified on their phones. One of the team members acknowledges the task, and minutes later, the bay is clean. The bay is now ready for the next patient. Turnaround time is minimized. Case number 4, bay 54, a patient with a suspected fracture needs an X-ray followed by an orthopedic consultation. The system notifies the orthopedist when the patient is back in the bay. The orthopedist's precious time is saved. You know, my wife is a doctor, and the number of times she came to the ED to visit a patient, to see a patient, just to find an empty bay is outrageous. Case number 5, that's the last case, the last example we'll discuss now. A trauma patient is rushed from the ED to the OR with life-supporting equipment, ventilator, and other devices. The command center initiates an immediate request to the respiratory team to replenish the missing equipment in the trauma room. This is true for critical life-supporting devices in trauma. This is also true for blood pressure meters or wheelchairs, stretchers, and any medical device required for the smooth operation of the ED. That's another example of the RTLS integration and its contribution to the command center. All right, so we talked about the product. Now let's see it in action. Let me give you a quick sneak peek into a live emergency department to see some aspects of the system in action. This is one of our design partners. Of course, we received their explicit concession to share this live view with you guys.
Now, Yaron, if you don't mind me sharing more, this is in actual real time that we're seeing this data being shared with all of our attendees.
Thank you, Nick. All right, so this is our control panel. In general, all our digital services are made available within this unified platform. Again, we are focusing on the command center, the ED command center. And this is how it looks like. So we're looking at a fairly large emergency department, close to 110 treatment bays and treatment rooms. The building number is 16. That's why it says ED 16. You can see the hierarchy, the department hierarchy in this page. And let's take a closer look at the treatment bays. All right, they are grouped into 3 different sections. What you see here, let's start with the list view. So we have a list view and a map view. All right, but we'll begin with a list view. You can see here all the bays, all the treatment bays with their live status. Okay, so we can start with the occupied ones. So you can see these are the occupied bays. For example, bay 308 in sub-department C. We can see the urgency level and a bunch of indicators received from the information system of the hospital. All right, so the urgency level, doctor checkup, and the different stages, the patient journey within the emergency department is clearly indicated in these icons, if you like. So we can see, for example, that the patient in bay 209 is waiting for blood draw. And once blood is drawn, you can see that for this, in this bay 204, blood was already drawn, and now they are waiting, the clinicians are waiting for the lab results to get back. And these are when it's full green, it means that all the information is ready for the next step. So again, you have a clear view of the status of every step in the journey of the specific patient. Of course, every status change, all right, doesn't matter any parameter we're talking about, whether the clinical parameters or the operational parameters we'll talk about in a second. Every status change sends the relevant notification to the relevant team members, right? So once the lab results are back, no one needs to refresh no page to see if the results are back or not. It's just the relevant person will get notification to their mobile device, lab results are back to this patient. And again, and the same goes for the operational requests that you see over here. If we go to the to this bay A114, you see that it is free. It doesn't have a patient in it, but it's still not ready to accept a patient because it awaits cleaning. Okay, and again, this requires the fact that this bay requires cleaning. A message was already sent to the relevant team member. They received the message, they acknowledge the message in their mobile device, and they are on their way to clean the bay. In a few minutes, I'm confident that this bay will turn green and ready to accept the next patient. All right, so that was the list view. We can see the map view, which is a map, all the bays spread in their actual location on the map, and the same color code indicates the status of each and every bay. This one we discussed, this one which awaits cleaning, for example. I can show you that the tablet view, I mentioned it briefly, that every bay, every room is equipped with a tablet installed attached onto the wall, and this is the display. Okay, we jumped into the tablet display, and you can see how simple it is for team members. You know, when they need a service, here we're talking about the operational services, but any other service, any service which we put on the tablet control, in a click of a button, just switching flipping the switch, they can order a cleaning service, laundry service, or a patient assistance service to the specific bay. And again, flipping the switch will not only change the display in the command center, but it will actually an action that will send the relevant notification to the relevant team member. All right, let's go back. So that's in short the command center UI. Now, I mentioned through the presentation that our command center is closely integrated with our real-time location system. Actually, the location system was the first product IntraPosition came up with. It was back in 2020. Since then, it's been deployed in numerous hospitals, great success. So let us have a few words about IntraPosition real-time location system. Location systems in general have been around in healthcare environment, in hospitals. RTLS has been around for probably 2 decades already. And most operations people you speak with in hospital, they all heard the term. They perhaps had an experience with the systems, legacy systems, most likely. But satisfaction levels with existing systems, if and when installed, are not very high. IntraPosition bring the latest and greatest technology, IntraPositioning technology, into this field. We are the first company that offers full-blown RTLS based on ultra-wideband technology, or UWB in short. This is the same radio technology that can be found in Apple's AirTag, for example. And this is more than just in healthcare. All technology giants, Apple, Google, and really all the rest have adopted this technology and acknowledged that this is the indoor positioning technology of the future, or location awareness technology of the future. And more services, location-based services, again, not specifically, not limited to the healthcare ecosystem, but generally speaking, rely on UWB technology. So we are the first company that offer this technology in the healthcare realm with 1-foot accuracy across the board. The technology is highly accurate. It relies on time of flight measurement. I won't get too technical now. This definitely requires a separate webinar, which we'll do in the near future. But what you need to remember is that once you have this system in place, this is one system that meets all your location-based needs. One tech that fits all your needs. You don't need to aggregate multiple technologies in order to touch different applications. The ease of deployment and the scalability of the system. Again, we can provide bed level accuracy easily, but you don't need bed level accuracy everywhere around the hospital. So the system is very flexible and very scalable, and you can start lean with, department level location awareness, and then from there progress to room level separation. And again, where needed, you'll get your bed level separation. Of course, the deployment of the infrastructure will have to take the required resolution into account. But it's the same system which can scale both in the size the area that it covers, and the level of detail that it provides. And the bottom line is always it's important, and the cost of the system, it's a fraction of the cost relative to legacy solutions. And again, with no compromise, I wouldn't say no compromise, it's the best performance you can expect from an RTLS system at a fraction of the cost. And this is, again, the name of the company, IntraPosition, started because this is was coined because this is what we started doing, providing exceptional RTLS services for healthcare. Let me give you a quick demo of the RTLS in the emergency department context. All right, so we are back to the intra-position control panel. Now I'm going to jump to asset tracking module. Here you can see all the, we are tracking, in this hospital, we are tracking close to 2,600 medical devices. But let's focus on the emergency department as well. So the building is the emergency department building, and we'll dive deeper into the specific floor. And in the specific floor, we see all the different sub-departments or units. And let's take a quick look on the 269 devices that are currently being tracked in this emergency department that I showed you. All right, can switch to full screen perhaps, because these are quite a lot of medical devices in each and every, and please note the level of detail. We know exactly what bay has exactly which equipment. So this ultrasound, for example, it's not just here in the ED, it's in a specific, we know it's in a specific bay A114 in this case, all right? So the system, when needed, and can actually monitor and make sure that the right equipment is available where it should be, right? Okay. All right. Actually, this is where our webinar comes to a conclusion. We have quite briefly reviewed the command center, IntraPosition's command center, our revolutionizing operation in emergency departments. And we touched the RTLS and its connection to the ED management. Thank you so much for joining us and spending your time with us. And if you have any questions, that would be a good time to type them in.
Thank you, Yaron. Yes, please. Thank you all for attending and joining us for this conversation. If you have any questions, please let us know in the chat, and we'll be able to address them as they come in. Okay. Yaron, I think you've done a great job explaining this whole
Always
thing.
clear. All right. Well, if you do find yourself wondering about a specific topic or subject that I have touched, so please feel free to contact me directly. This is my email over here. I urge you to visit our website and see our different services. You can get in touch with us through our website as well. Thank you again for your time.
Hold on, Yaron, just 1 second, please. We have a question from Julio. He's asking, how is the ED command center system compared to Lean solution?
Compared to Lean solution?
Yeah. Julio, would you mind elaborating a little bit more?
One second.
They use a platform called Lean in Germany and Switzerland.
Mm-hmm. Well, I'm not, to be honest, I'm not familiar specifically with Lean. Yeah. After initial installation deployment, what is required for maintenance and service? So we have a question here. Actually, the system is quite maintenance free. I mean, it's a software. It's a cloud-based platform, and it's maintenance free. When we're talking about the command center, of course.
Yeah.
You do need to make sure that if you make adjustments to the ED, we saw that actually that bays are changing and moving, and they're adding bays in this subsection or subdepartment of the ED and making changes, you do need to make sure that the system is updated accordingly. It's a very simple operation. I'm talking about a few minutes with our support, so it's really a no-brainer. But yeah, you do want to make sure that the digital twin that you create is actually a twin that matches reality on the ground.
layout of the emergency department. Yeah,
that's right.
Totally agree. Yeah. We can get back to Julio by email regarding the system that they're using in Germany after a little bit of a deep digging in there. We have another question. Has this been implemented in the US, or are we working on?
The product was just launched, and we are servicing hospitals in Israel. The largest health system in Israel is using this platform, but we are in the making our first steps into the US market, marketing this product, hence the webinar and other efforts that we put into it.
Okay. What about the RTLS platform? We have any solution?
So the RTLS is installed in Mass General Brigham, in their Mass Pioneer, especially hospital. A great, may I say, satisfied customer. By the way, if you open to visits, if you guys want to see the system in action, I know there are many doubts when it comes to RTLS due to 2 decades of not very good experience people had with legacy solutions. And so if you want to see a successful and a good system in action, book your flight to Boston and we'll meet you there.
Certainly. We got another question. I think this is an additional one. Does the initial cost include the tablets for each room? The second, sorry, go ahead.
Yeah. So we can provide the tablets, or we can, recommend the relevant model, because the system is web-based. So it's really, we give you the standards and the specifications for the tablets, and it's very simple. We use them in kiosk mode. We will guide you through it, but we can either get them for you, but there's no real good reason for that. I'm sure the IT team can do that as well. So whatever works better for the hospital IT team, we can bring them with us, of course, and adding the cost of the tablets. These are standard tablets. Yes, the wall mounts, again, if the local team doesn't have any preference, we can bring the wall mounts as well.
Fantastic. And we got a question from Fernando. You mentioned having a solution for newborns. Do you already have any implemented solutions out there? And could you please provide more details about them?
Yeah. Did I mention the newborns? Actually, I made sure I didn't. So someone here heard us. But the newborns, the reason I didn't mention it, because it's coming soon. We are working on it. We're very excited about it. It's a small size tag with a pairing mechanism, mother-baby pairing, and all the baby safety features required. We are coming with this feature early next year with this service, and we'll be thrilled to introduce it to the US market once it's ready. We are in the final steps of development and testing of the product.
All right, fantastic. Do we have any more questions? Well, great. Well, thank you all for attending. We truly appreciate it. If you have any questions, like Yoran said, his email is displayed here on the screen. Feel free to reach out to us as well. IntraPosition or Pegasus Medical. We can get one of our colleagues to get connected with you if you have any further questions or concerns. And stay tuned for more updates regarding this and also our TLS application. Thank you all.
Thank you very much.
Thank you, Yaron.
Take care.
Yes, yes, Jim, we can send you a copy of the recording for sure. Thank you, guys.
Thank you.
Thank you all. Bye.